So Barrett's esophagus is a condition that develops, we believe, because of acid and bile reflux. And what happens is when people have a long-term reflux, the inner lining of the esophagus, which is your food pipe connecting your mouth to your stomach, the bottom end of that esophagus, the inner lining changes and it begins to look like the lining of your stomach. And that is called Barrett's esophagus. So it is basically an abnormal lining at the bottom end of your esophagus. Barrett's esophagus is common in the Western world, but it is not hereditary. We can sometimes see familial localization. So we can see more than one patient in the same family, but that doesn't mean that there is a hereditary transmission of this disease. And there are also genes linked to Barrett's esophagus, but again, the true answer is there is no hereditary transmission of Barrett's esophagus. It's more related to environment, lifestyle, and our own genetic background. So the question related to diet and various health conditions is very common. And everybody likes to know what they can do to avoid or treat the condition. And that's a very good way of thinking about it. So coming back to specifically about diet and Barrett's esophagus, there is no direct interaction between Barrett's and diet. However, as I said, Barrett's is a condition which is caused or worsened by reflux, and reflux is affected by various types of diet. So indirectly, there's a connection between Barrett's and diet. So we need to know those food and dietary habits that makes our reflux worse and then avoid them. So some of the common examples of things that make our reflux worse is fatty food, spicy food, fizzy drinks, too much alcohol, tea, coffee, again, things like going to bed within a couple of hours of having a big meal. So lying down flat, that allows food to an acid to reflux back into your esophagus. So basically what I'm saying is eating early in the evening or having at least 2 to 3 hours of gap between having a meal and lying down. The other important thing to note would be instead of frequent snacking, if people can adopt a habit of just having 3 proper meals, that also reduces reflux. So these are the common things that people can adopt in their diet and lifestyle to reduce the risk with Barrett's. So Barrett's esophagus in itself doesn't have any symptom. It's a completely asymptomatic condition, can only be diagnosed by having an endoscopy. So it doesn't have any symptoms, but Barrett's is commonly associated with reflux. And reflux can give you all kinds of symptoms like heartburn, food or acid coming up to your mouth, frequent burping. And in some patients, because of reflux and acid coming into your esophagus, the esophagus becomes very sensitive and it can go into spasm. And when it goes into spasm, it can give you chest pain or very rarely back pain. And this is very rare and it's not directly related to Barrett's, but is related to acid reflux. So something for people to think about. Barrett's esophagus is considered as a pre-malignant condition, by which what we mean is it can, in a very small proportion of patients, lead to development of cancer. That is why patients who have Barrett's esophagus, we perform endoscopy every 2 to 3 years to monitor their Barrett's, take biopsies, evaluate to make sure that no nasty change is happening. But the risk is very small. Only about 0.5 to about 1% of the patients per year will convert from Barrett's to cancer. So it's not a high risk, but there is a risk. The biggest challenge we face is we do not know which Barrett's patient will progress on to cancer, which patient will not. That's why all these patients are monitored on a regular basis. And if you're being monitored properly by a clinician who has a big interest in Barrett's, then I don't think patients should worry about this.